This is In Step with Compliance, a podcast by the Modern Practice Solutions team for dental professionals.
Welcome to In Step with Compliance. My name is Olivia and I'll be your moderator. This episode is sponsored by Modern Practice Solutions. So today, Caitlin Dennison and I are talking about recent issues that we've run into where TOSHA, Tennessee OSHA, has been citing numerous dental offices in the area. And we thought that this episode would be helpful in guiding listeners to know what they are looking for and what they are picking on. So, Caitlin, let's start this conversation. I know I spoke with you recently that I was in a major hospital the other day and I noticed numerous serious safety violations, such as healthcare clinical people not wearing proper personal protective equipment, not disposing of blood saturated gauze in the proper medical waste receptacle, blood on the walls. And yet, it's these little dental offices that are being targeted. What have you seen in working with dental practices lately?
Well, yeah, we've certainly seen several dental practices in the state of Tennessee be cited by various regional offices lately. And it turns out that the crux of this issue tends to be dental offices' use and handling of sharps and contaminated sharps. So that's the theme for these citations we're seeing. The first one I have here, removing or recapping needles without demonstrating that no alternative is available or that such action was required by a specific procedure. And as an office manager told me recently in regards to their office inspection, TOSHA really seems fixated on the whole recapping thing. And this was a very astute observation from this manager. You can almost guarantee that a TOSHA inspector is going to be concerned, perplexed, or even upset about the routine and necessary process of recapping anesthetic needles, because this is a procedure that is not necessarily required in other fields of medicine. The OSHA bloodborne pathogen standard specifically prohibits bending and recapping needles unless the task being performed requires this to be done. So a TOSHA inspector who has not worked in dentistry, and fair enough, many of them have not, or who is more familiar with sharps used in medical facilities, is likely not going to understand that recapping and removal of needles from syringes is essentially unavoidable in dentistry. So this begs the question, how do we avoid the citation in the first place?
So let's stop right there for a second. So, Caitlin, I think the important point is that these inspectors are zeroing in on the fact that in dentistry, there is the need for multi-site injections. And so one patient may have multiple injections. So that means the needle is on the tray. So they're concerned about that, right?
Mm-hmm.
And then they're concerned about disposal. So it still gets me aggravated that, you go into a hospital where there's thousands of workers and there's gross violations there, but yet they're going to pick on these little dental offices knowing that they're going to walk in and they're going to find this violation. So how do we avoid that citation, Caitlin? What's the solution for clients?
So as with most things when it comes to compliance, documentation is key. You want to ensure that your exposure control plan or your ECP clearly states why you're doing this, because remember that the standard does allow for this if it's absolutely necessary. And of course, in dentistry, like you said, it is necessary because we're giving those multi-site injections using the same needle, carpule, and aspirating syringe apparatus, right? So explain why it's unavoidable and explain why you're recapping that needle, because the whole reason you're recapping it is to keep the patients and employees safe. So the inspectors do appreciate it. They do tend to understand once they have seen this written out why this is necessary. So get ahead of it and write it down ahead of time.
Yeah, so that's key. The work exposure control plan has to be modified. We have since modified our template. But that's another thing that just really irritates me is that if TOSHA were to go in and assess an office and say, oh, you need to modify. When they give a model plan, none of that's in there. None of that's in the model plan. So they expect these dental offices to customize and make the necessary edits to reflect what you just said. And so it's important for our listeners to understand you are no longer in compliance because what Tennessee is specifically looking for is not something that they picked on a year ago. So as TOSHA becomes more conscientious and zeroing in on these issues, we have to get people up and going to keep up to the speed that OSHA is going. Would you agree?
Yeah, and to your point, one of the inspectors noted to me that he was upset that the office was not following exactly the procedure outlined in their own exposure control plan. So if you're buying an exposure control plan somewhere, it probably has a good procedure in it, but it's not your exposure control plan if you're not even doing what it says, right? So to your point about specificity, like it's your plan, make it match what you're doing.
So true, because for whatever reason, they are popping in at these dental offices, and these dental offices are getting at least one citation.
Mm-hmm. Mm-hmm.
What else should they look for?
So related again to the use of contaminated sharps, we have the need to evaluate an engineering control. So, oftentimes there's not going to be a safer device on the market for you to provide your employees to do their job safer. We're just going to do the best we can. So what I want you to ask yourself is, have we evaluated a device this year that might help my employees be safer? Devices would include things like needle recapping devices, sheaths that slide over needles. These are all things you could examine during the year and see if you'd like to implement them. And I shouldn't say you could, you have to. You're required to examine one of these each year. So whether you like it or not, pick a device, document that you reviewed it, and file that away. Maybe implement the device if it's a great one, but at least evaluate one.
And OSHA is so picky in Tennessee, they want you to list all of the sharps that are in use. So your sutures, syringes, blades, scalpels, whatever is in use, they want you to list everything and then a possible alternative. And so that's what it takes in this state to pass a compliance audit.
Yeah, and if you're not using the safer alternative, be prepared to explain why not, because it gets really tricky when you're using the least safe option on the market and you have to explain to TOSHA why. And the safe device being too expensive is not going to fly. You need a legitimate reason, or you need to be using the safer device.
So true. What else can you suggest to our listeners that you've run into lately?
So finally, I have, and this is very similar to the previous citation, is failure to use engineering or work practice controls to eliminate or minimize exposure. And this, again, is typically cited when it comes to recapping or removing needles. I just want you to ask yourself, say you're a practice manager, ask yourself, are my employees doing this task in the safest way possible? Be that through the use of engineering controls like a recapping device, or through work practice controls like a single-handed scoop technique. And if you can't confidently explain that, yes, your employees are using all the available options to make this a safe procedure, then you may be looking at a citation. So get those work practice controls in place, get those engineering controls in place, and document them in your ECP.
So for a minute, let's just take your hat off as a compliance trainer and consultant and go back to the days that you were an OSHA compliance officer where you went on site working for the state. What was your experience then?
Yeah, and so because I was a TOSHA inspector, I have a little bit of sympathy for the inspectors. They're not familiar, in my experience, I was not familiar with dentistry. And so some of the tools and some of the issues we see are a little bit perplexing, right? Like if you don't understand the need for an aspirating syringe, if you don't understand that, you have to do things a certain way, it seems like a willful violation, right? It seems like they're just being reckless. But when you've been in dentistry, you understand that we're working with what's available, right? So,
Yeah, good point. And would you say rarely when you did inspections that you walked away from a work site, not necessarily just a dental office, with no violations noted?
it happens sometimes, but I will say it's hard for that to happen in a general schedule because remember, a general schedule is looking at everything. And again, it does happen, but you really have to have things buttoned up to achieve that. If you've done that, let us know because we're very proud of you. That's quite the accomplishment.
So we try to help people the best we can, but a lot of times something will be noted for
Yeah.
improvement, something may
Mm-hmm.
be cited, and things change. You know, the OSHA officers that we worked with a couple years ago are different ones now, and
Mm-hmm.
how thoroughly they evaluate is different than what we
Yeah.
saw in years past.
100%. And OSHA leaves things ever so slightly open to interpretation. So, whoever's sitting behind that supervisor's desk has a little bit of leeway as far as how we're interpreting what OSHA wants us to do, right? As is the case with any law, there's a little bit of room for movement there. So it's important that we're on the ground and staying updated with what's actually happening, right? Because it's not always exactly what's written.
So if TOSHA notes a violation and issues citation, speak to us about the opportunity to appeal.
Yeah, so when you receive your citations, it nicely lists out your deadlines for contesting a citation or for attending an informal conference. And I tend to be in favor if you've gotten cited for something and in the back of your mind, you're like, this just isn't correct. I wasn't doing this, or in the case of dentistry, I was doing this to the best of our ability, right? I was
Mhm.
keeping my employees as safe as possible. The informal conference is a chance for you to sit down with your inspector and your inspector's supervisor and discuss those citations and give your side of the story. And in this conference, you can then request a reduction of fines. You can request that a citation be dropped. That may or may not happen, but that's your best opportunity to chat with the inspector one-on-one. Now, if you're not satisfied with that, you could contest the citations, although that's going to be a more lengthy and potentially expensive process for you.
And then you have to think about, well, if the citation's $300 and the doctor's time is worth so much more, they may sometimes opt just to pay for it and move on. Recently, I've worked with the dental board on an investigation, and you think of OSHA about safety, but the dental board will ask for the safety plans. They will
Mm-hmm.
ask for it, and they will ask for the infection control plan and assess issues like that. So don't think, well, if you're great with an OSHA visit, the dental
Yeah.
board will come in too, and they have authority. And then it's public discipline.
Yes. Yeah. Sometimes people will buy these OSHA plans and they're really teeny tiny. And we say, that may very well be great for OSHA, but you're not considering the other agencies that could come in and that's not going to satisfy them. So that's why our manual is nice and big.
Yes. And I do appreciate the opportunity if, especially one of our clients is dealing with a board investigation, to be present as their counsel to sit through those meetings and make sure that things are going along nicely.
Mm-hmm. Mm-hmm.
So that wraps up this episode, and we appreciate our listeners tuning in. And please be assured that we're working very hard behind the scenes to stay in step with what TOSHA is citing so we can prepare clients, train them, revise policies as necessary. So thank you for tuning in to In Step with Compliance, sponsored by Modern Practice Solutions. Please visit our website at modernpracticesolutions.com.